Welcome back to SDSU. We are so excited to be able to have you back on campus for in-person courses and activities. This video provides information on spring 2022 COVID-19 infection prevention and policies. It is important for members of our community to understand these guidelines and policies so that we can all have a healthier and safer semester. Additionally, we want you to avoid the outcomes of violating COVID-19 policies, which can range from a warning to suspension. Once we discuss the policies, we will share some of the exciting opportunities that we have planned for students to come together safely on campus this spring. First, let's discuss SDSU's vaccination policy. As the California State University announced, the COVID-19 vaccine is required for all students, staff, faculty, and visitors who will be physically on campus this spring semester. Whether you are on campus for classes, work, research, events, or student organization activities, you will need to have a COVID-19 vaccine and booster on file with SDSU. Students must upload proof of vaccination and booster to Healthy Connect, the university's secure online health portal, prior to Tuesday, January 18th. The upload process takes less than 10 minutes. Again, if you plan to be on campus or at an SDSU facility at any point this spring, you must be vaccinated. The CSU COVID-19 vaccination requirement allows for students, faculty, and staff to seek an exemption based on medical or religious grounds. New exemption requests for students and faculty and staff must be submitted before the start of the semester. Those with prior exemptions will not need to submit a new one unless the existing exemption no longer applies. Students who have a 1 or 2 dose vaccine series on file but are looking for a booster exemption will be automatically enrolled in a testing program. No exemption request is necessary. Students who are not vaccinated will also be required to complete a daily health screening. As a reminder, the COVID-19 vaccine and booster is required for all students, staff, and faculty in order to access campus this spring semester, with certain exceptions. If you have received 2 shots of either the Moderna or Pfizer series vaccine less than 5 months prior to January 18th, or if you have received a Johnson & Johnson vaccine less than 2 months prior to January 18th, you are not yet eligible for the booster and will not be entered into a testing protocol until the date you become eligible for the booster. If you recently tested positive, once your isolation period is over and you are fever-free, you can receive the booster. If you have any questions regarding the booster, we recommend discussing them with your primary care provider. It is also important that you follow the university's updated facial covering policy, which provides direction for those who are vaccinated and those who are unvaccinated. Please pay close attention to the policy and refer to it based on your vaccination status. For those that are not vaccinated but have an approved medical or religious exemption on file with the university, facial coverings must be worn at all times while indoors, when in instructional settings, whether indoors or outdoors, and outdoors when unable to maintain 6 feet of distance from others. Certain limited exceptions to wearing facial coverings will be granted to unvaccinated individuals, which are outlined in the full policy online. For individuals that are fully vaccinated, including a booster, facial coverings are required in the following settings: whenever students are indoors, and when in instructional settings, whether that be indoors or outdoors. This includes classrooms, instructional labs, spaces being actively used in an instructional capacity, and the university libraries. It is important to note that vaccinated instructional faculty, teaching assistants, and interpreters can remove their facial coverings when teaching as long as all students are masked in the classroom. Recognizing COVID-19 symptoms. Let's quickly review the symptoms associated with COVID-19. It is crucial for everyone to recognize these symptoms. Symptoms include runny nose, congestion, sore throat, fatigue, headache, cough, shortness of breath, difficulty breathing, high fever, chills, body or muscle aches, nausea or vomiting, or a new loss of taste or smell. Symptoms may appear 2 to 14 days after exposure to the virus. An individual with COVID-19 is contagious to others in the 2 days before they develop symptoms and throughout their illness. It is also possible for an individual to be asymptomatic, meaning they are infected with COVID-19 but do not experience or show any symptoms. Even if a person is asymptomatic, they can still spread the disease to others. While the vaccine is the most effective prevention method against getting COVID-19, even vaccinated persons may still get COVID-19, though the symptoms are often much more mild than those who have not been vaccinated. Again, you absolutely should not attend class or spend any time with people if you are experiencing any COVID-19 symptoms. Stay home or immediately go home if you start experiencing symptoms, and seek testing right away. Your health and safety and that of all others on campus is our #1 priority. It should be your #1 priority as well. Students who are experiencing symptoms of any sort of illness should refrain from coming to campus or leaving their room if living in residence halls for any other reason other than to seek medical care or a COVID test. For your own health and your fellow SDSU community, we advise you to please stay home or go home if you begin experiencing any symptoms of illness, regardless of severity. This new norm is being communicated to faculty, staff, and students. You should feel empowered to work directly with your professors regarding any missed work and/or class time. If you are experiencing COVID-19 symptoms, get tested. Residence hall students have to test within 6 hours of experiencing symptoms, even if they choose to go home. Students living in a residence hall may only leave their room to get tested or to receive medical care. Off-campus students should be tested within 24 hours of experiencing symptoms. Students living off-campus may not come to campus for any reason other than to test or to receive medical care while they have symptoms and are awaiting test results. If your test is negative, do not return to class until at least 24 hours has passed since your last fever and you have improvement in your symptoms. Now let's discuss the specifics of SDSU's isolation and quarantine policies. Just like in past semesters, SDSU community members who have been diagnosed with COVID-19 must isolate themselves for a period of 10 days, regardless of vaccination and booster status. Individuals are not to come to campus for work, classes, or activities during their period of isolation, and should remain home unless they must leave for testing or medical care. So what's new? In some cases, individuals may now end their isolation prior to the 10th day with the approval of the SDSU COVID clearance team. To be qualified to exit isolation prior to the 10th day, all individuals must have a negative COVID-19 test and must commit to wearing a facial covering, regardless of whether they had symptoms and regardless of their vaccination or booster status. Testing results must be laboratory verified, meaning conducted by a laboratory with a written lab result. Individuals who would like early release from isolation should submit an online request to the SDSU COVID clearance team for review and approval. Individuals cannot be cleared for early release through any other mechanism, including direction from a supervisor. Now let's talk about quarantine. Just like in past semesters, all SDSU community members who are not fully vaccinated, which now includes a booster, must quarantine for 10 days if they are identified as a close contact to someone who is COVID positive. A close contact is defined as being within 6 feet of someone who is COVID positive for 15 minutes or more over a 24-hour period during the time that person was infectious. All community members who have been identified as a close contact to someone who was COVID positive are encouraged to test on the 5th day following exposure using the COVID-19 testing options available on campus or in the community. Testing and disclosure policies. Let's review COVID-19 testing and disclosure policies. Students who have an approved vaccine exemption on file must get tested every 5 days in order to remain clear for campus access. Students who have any COVID-like symptoms are also required to get tested. If you are tested at any location other than Student Health Services, you must upload documentation to Healthy Connect. We cannot accept submissions via email. Please ensure your results have your name clearly visible on them. This is also a university policy and outlined in the Student Code of Conduct. Students who have tested positive or been knowingly exposed to COVID-19 must notify Student Health Services in a timely manner, which means within 2 hours after a positive test result. If a residential student has tested positive, they will be moved to an isolation unit. Students who are in an isolation or quarantine must not attend in-person classes, activities, visit other on-campus facilities, or end isolation until they have completed the CDC's guidelines to discontinue home isolation. There are a few testing options available for SDSU students. Students can get tested through SDSU's Student Health Services, testing kits available at vending machines on campus, or their preferred healthcare provider. The test must be molecular, which means PCR, RT-PCR, TMA, LAMP, or NAAT testing only. Antigen and antibody testing will not be accepted. Next, we'll discuss residential policies. San Diego State University has taken and will continue to take multiple measures to protect the health and safety of students living in on-campus housing. However, it is important to understand that these measures cannot completely eliminate the risk of COVID-19 exposure. Upon move-in, all spring 2022 on-campus residents, including those who are vaccinated and boosted, must have a negative COVID-19 test administered within 3 days prior to moving into on-campus housing, as well as complete the required rapid testing on the day of move-in. Students can quickly and easily upload their test results to the university's Healthy Connect portal, the university's secure online health platform, at least 48 hours before move-in. Any residential student who receives a positive COVID-19 test or fails to upload proof of a negative COVID-19 test will not be permitted to move into on-campus housing during their assigned move-in period. Residential students must also upload their COVID-19 vaccination records to Healthy Connect at least 48 hours prior to their assigned move-in date, unless they have been approved for an exemption by the university. As a part of SDSU's housing agreement, students living on campus must wear facial coverings in accordance with the university's facial covering policy, wash their hands frequently with soap and water for at least 20 seconds, avoid touching the nose, eyes, and mouth, practice good respiratory etiquette, which includes covering coughs and sneezes, avoid close contact with people who are sick, stay in an assigned isolation space if sick, isolate or quarantine if instructed by a medical or public health professional to do so, maintain supply of hand sanitizer, face masks, and a thermometer, recognize personal risk factors. People with underlying health conditions are at a greater risk of developing more serious complications from COVID-19. Regarding guest policies, residents living on campus may only have guests in their residential spaces, including personal space and community spaces such as lounges, study rooms, and outdoor recreation areas, who live in on-campus residential communities. The only exception to this is those providing assistance to move the resident into and out of the residential space. Such assistance must comply with all current public health guidelines, including physical distancing and the use of personal protective equipment, and must be limited to the actual time required for move-in or move-out. Finally, let's talk about campus event policies. This spring, we will have many exciting opportunities to come together as a campus community. These opportunities include Aztec Nights events, SDSU Go field trips, One SDSU community events, and more. Knowing what to expect in terms of COVID-19 policies is crucial to ensure a safer and enjoyable experience. The university's COVID-19 campus activities policy is published online on the Center for Student Organizations and Activities website. The COVID-19 campus activities policy is responsive to the evolving needs of our campus community during the COVID-19 pandemic and is subject to change. Some programs, such as Aztec Nights, may also have policies for their events. A few highlighted expectations for the beginning of the spring 2022 term include: event attendees must be approved to access campus in order to participate in the activity, whether it is on or off campus. Students should be prepared to show their campus clearance indicator through Healthy Connect upon event entry. Event attendees may not come to the event if they are showing any signs of illness, whether COVID-19 related or otherwise, or if they are currently under an order to isolate or quarantine. All attendees will be required to wear facial coverings at all times in accordance with the university's facial covering policy. And non-SDSU students will not be permitted to attend Aztec Nights events. All students must abide by published COVID-19 policies at events on campus, all programs hosted by campus departments, and all activities facilitated by recognized student organizations in order to avoid consequences such as cancellation of the activity or disciplinary consequences. Thank you so much for taking important steps to help prevent the spread of COVID-19. You can stay up to date on the latest information through the SDSU's COVID-19 Weekly Digest, which is sent to your SDSU email address. For more information, visit our website, sdsu.edu/COVID-19. If you have COVID-19 related questions or concerns, email covidclearance@sdsu.edu. You will now have the ability to test your knowledge. You can take the following quiz in order to reinforce what you've learned during this training, and/or indicate the completion of this training if you are doing so as a requirement.